Dr. Mobley, what is a chin implant?
Chin implants, when you think about it, it's a very basic question, but they're actually sort of misnamed because we've been calling them chin implants for decades. But I often tell my patients that they're really jawline enhancers. If you look at sort of the original chin implants, they were meant to go just in the chin area. But with few exceptions, no one uses these anymore. They're kind of considered outdated. Most of the modern chin implants now are really jawline enhancers designed to go along the lower border of the jawbone and really enhance, I would say that's easily 2/3 of your entire jawbone. So we do call them chin implants. That's a pretty common expression, but in my practice, I actually like to educate patients that we're probably more appropriate to call them jawline enhancers. And that's what most people are seeking is jawline enhancement.
Some people might be concerned with foreign objects in their body. What are these implants made out of, and what is their safety?
It's a great question. I hear that frequently in consultation. And depending on your age and how long you've been following healthcare, if you go back to maybe the 1990s, breast implants in women had a huge multi-million-dollar settlement because it was found that the silicone breast implant material was leaking into their bodies and causing all these health problems. And so implants kind of got a bad rap. So these modern implants are made out of a medical grade plastic, but unlike breast implants that again, many years ago got a bad reputation for leaking and causing problems, there's nothing to leak. These are solid plastic. There's nothing that's going to break off or leak or go into your body. This type of material called silastic is extremely inert, meaning your body doesn't really react to it. And the nice thing about these things is they really have been used since probably the late 1970s. So we've got multiple decades of data to know that they're safe, they don't cause immune system reactions, and if you, for some reason, ever didn't like your implant, they come out really easily. That's pretty rare, but if you don't like it, they come out just as easy as we can put them back in.
Could you share with us a little bit more about your personal background and experience with performing chin implants?
Yeah, I think everyone's influenced by who trained them. So if you go back many years ago when I was a resident and a fellow in training both in Miami and Chicago, the people that trained me just happened to be pioneers of chin implants going back, some 20 years ago. I've always found chin implants sort of a fascinating procedure to perform. I would tell a lot of people who come in for a chin implant consultation that in terms of the sort of the length of the procedure, meaning we can do a chin implant typically in about an hour, the cost of the procedure, it's on the lower side of the cost spectrum because it is a shorter procedure, and just sort of the cosmetic wow, like you can look really a lot better. If you've got a weaker chin and kind of a more recessed chin, you put an attractive chin implant to someone, it can really enhance their appearance. So I've always been quite interested in them. Fast forward many years, I actually became a national teacher for chin implant surgery. There's two major companies in America that make the chin implants. One's called Implant, and I was an official Implant teacher. So surgeons would fly in from around the country. We've had some doctors flying from Canada, and I was often the one in charge of teaching how to do the chin implants. Statistics I'm proud of: the average facial plastic surgeon in America is maybe doing 6 or 8 implants per year. We do more like 20 to 30 per year. I think one year we did almost 45 or 50. So you can do your own homework, but you're going to be hard pressed to find a surgeon in this part of the country or maybe anywhere in North America that does as many chin implants per year as I do. And I'm very proud of that.
Some women might worry about a chin implant creating a more masculine appearance. Could you speak to this concern and explain how you address it with your patients?
Yeah, it's a great question. Matter of fact, I was at a national facial plastic surgery meeting. I think it was October, November of last year, 2023. And a well-respected person, a surgeon I know personally from the California area, said, "Oh, I don't do chin implants because I don't want my female patients looking like dudes," or something kind of like, kind of rough like that. And I think that they have gotten a bad rap in some circles. And admittedly, a lot of the chin implant designs that are common these days, if you look at the actual sort of silhouette of the design, it is true that when you put these in patients, some female patients, they can make the face look a little masculine. Now, I noticed this many, many years ago, and so I started to custom carve my chin implants. And some people hear that and they think, oh, that's kind of basic, or some people hear that and think, wow, that's pretty pioneering. But basically, in real time during surgery, I've developed some sort of proprietary instruments where I can take away some of the implant material. That way, when the patient is on the table, we're putting the implant in them, checking how it looks, we can in real time modify the implant and make sure it does not look masculine, but indeed looks feminine and attractive. Even for my male patients, I find that doing the custom carving can sometimes just give that perfect look to the jawline. And so, to my knowledge, there aren't a lot of doctors that do the custom carving. It's something that I like to speak about when I teach nationally. And to this day, when I talk about it, people, my own peers, will be like, "Oh, wow, I never thought about like changing the shape during the surgery." So yes, they can make your face look masculine, but when you work with me, because of the custom carving, that's not going to be a problem.
Dr. Mobley, could you walk me through the process of placing these chin implants?
For sure. So there's basically two different ways to put a chin implant in. And looking at our little fake skull here, you can make a little incision kind of inside the mouth and put it in from above, or you can make a tiny little incision and put it in from below. There's controversies in this, and there's pros and cons to both approaches, but without giving a 15-minute talk on just that topic, I like to come in from below because it is a very known medical fact that our mouths are full of bacteria. That's just a natural medical fact. If you put the implant through the mouth, you're exposing the implant to all that bacteria that's in our mouth. When you come from below, you're not exposing the implant to any bacteria. And I've literally, in a 20+ year career, I've never had a chin implant get infected. There's few times a surgeon can say I've never had a chin implant getting infected. And I always place them from below. And because these chin implants are very bendable out of that material we talked about, this elastic material, you basically can place them in the chin with an incision about that wide. And if you properly put that little tiny cut there and close it with plastic surgery technique, you can't even spot that scar after about 6 months. So I think coming from below is a little bit safer. And a lot of my patients don't only do a chin implant by itself, but many patients who would benefit from a cosmetic chin implant would also benefit from other procedures, like maybe some neck liposuction or maybe some tightening of the neck muscles. So we need to make that incision anyway. So I tend to put them in from below, and I've had no trouble doing that for many years.
What is your personal favorite chin implant to use, and why do you prefer that one over the others?
That's a great question. There are multiple implants available in the market. And again, I mentioned earlier, there's kind of two major companies. They really kind of make the same sort of selection of what we call different styles. So there are probably 5 or 6 major styles of chin implants available to surgeons in the country. And then each style implant tends to come in a small, medium, large, extra large size. You can imagine that creates a lot of possible sizes and shapes. In my practice, I tend to use 2 common implants, often referred to in my line of work. One is called the extended anatomical chin, which is kind of this guy here. And the other one is called the Middleman pre-jowl chin implant, named after a famous surgeon and friend of mine, Dr. Harry Middleman from California. The Middleman chin implant has a little more material here, so if your jaw needs a little bit more fullness kind of on the sides, I might choose more of a Middleman style implant. But again, because I custom carve, a lot of times for me, the implant is just kind of the base, and then it's through my artistry and carving that I give that patient the final shape. But those are the 2 most common ones that I found effective.
Do chin implants ever become displaced, and how do you ensure they stay securely in place after surgery?
Yeah, displacement of the implant is a really common concern. The good news is in real world experience, it's very uncommon. When I talk to patients about this, I remind them that, hey, we live in the great state of Utah. We've got a lot of active people that are wearing helmets to go snowboarding, skiing, mountain biking, all the different things that we enjoy doing. Again, in over 20 years of experience, I've only had 1 chin implant ever become dislodged after surgery. And again, there's literally hundreds of people walking around the state of Utah or other states who've had a chin implant by me, and we've only ever seen 1 implant become dislodged. That person was punched in the face in kind of a bar fight story. So I guess with the exception of 1 patient in over 20 years, I've never had 1 become dislodged. And I don't ever use screws. That's kind of a myth that people put them in with screws. Screws are used in different types of jaw surgery, more typically the kind of jaw surgery that maybe an oral surgeon would do. When we're talking about chin implants, because they are flexible, we can actually put stitches into them and secure them to the jaw with stitches, so you don't have any additional screws or unusual things along the jawline, just stitches that eventually dissolve, and then just the soft tissues around your jawline will hold the chin implant in place.
In contrast to women seeking a more feminine look, many men are aiming for a chiseled jaw look. Would a chin implant still help male patients achieve this more defined appearance?
Yeah, for sure. Like we talked about, and I often call them jawline enhancers, although we can't help but just call them chin implants because that's such a common term. And like I was explaining earlier, if you kind of look at this little model here, and you can imagine this chin implant on the model, it's giving you already enhancement of probably 2/3 of your jaw. Now, this final little area back here is tricky. There is an implant that has been developed for going to the very back edge of the jaw. The problem is, in my experience, I've seen that implant cause patients major problems. I've seen it get infected. It's placed through the mouth. Again, we talked about that. Sometimes you chew something hard, you could break the stitches open. I've stayed away from that implant. I never want to put something into somebody that's going to cause them like a long-term health concern. And like I said, with chin implants, I've had no trouble. In over 20 years, never had one get infected or cause any major problems. So if a man is looking for that back of the jaw to be more angled and chiseled, I find just putting a long-lasting, thicker filler along the jawbone will do a very similar thing cosmetically, but not expose that patient to the lifetime risk of having a posterior jaw implant that unfortunately I have seen become infected and cause problems. So I stay away from those.
We all know surgery can be kind of scary, so what are some different anesthesia techniques you like to use to keep your patients calm and comfortable?
There's a broad spectrum, and that's definitely something that we talk about on the initial consultation. Every patient I want to sort of gauge, like, where is their comfort level? Some people are very tough and stoic, and in this situation, if you're really super tough, you can do this local anesthesia only. Think about going to the dentist and getting your nerve block, and they might fill a cavity. So we can do nerve blocks for the chin and do it completely under local anesthesia only. Personally, that would be my choice. The next layer of comfort would be to do local anesthesia plus an oral sedative tablet. We have a very effective tablet called the MKO Melt, which is kind of new in healthcare. It's only been out for a couple of years. We've been using it almost since it was first sort of released onto the market. It'll make you feel relaxed, kind of giddy, and can make it a very pleasant experience. Again, I would probably still go a little further if it were me. The next step in giving patients comfort and relaxation is to go through IV sedation. This to me is kind of the sweet spot. You'll have an experienced anesthesia provider. I got to brag because I work with some of the best anesthesia providers in the state, all of them extremely experts at intraoperative IV sedation, where you as a patient are kind of just in a nice little chemical sleep. But if we still said something like, hey, lift your chin up, or hey, turn your head to the right, you would still kind of hear that and process that. But if we talk to you in recovery room afterwards, the whole thing would just be kind of like a pleasant blur. So IV sedation to me is kind of the sweet spot. You'll have no recollection of any pain or discomfort, and yet when you hit recovery, it wears off rather quickly, and you can usually be discharged safely within about 45 or 60 minutes. At the highest level of sedation is if you're really what we call procedure phobic, then we can put you under full general anesthesia. But for most patients, that's unnecessary. So I think for most patients, it's either going to be the oral sedative if you're kind of on the tougher side, or if you're a wimp like me, I would do the IV sedation, because I know if I do that, I won't have any memories of anything pokey or painful. And so I find IV sedation is a great way to do these.
So if I'm watching this video and decide that I might want a chin implant, how might I get started?
Yeah, the first step is always go to mobleymd.com. I think I have one of the most extensive educational websites out there. We have an entire page devoted to chin implants. Go to the page, read the information that's on the page, go down to the bottom of the page, read the FAQs, the frequently asked questions. That's a good place to start. Call the office, speak to one of our patient coordinators. They'll answer all of your common questions over the phone. A lot of patients from out of town like to come into Salt Lake City to have me do their surgery. We cater to that as well. You can send some photos. We can do a virtual consult. A lot of people do a virtual consult and then maybe come in one day before their surgery. So we meet face to face. We're ready to do the surgery the next day. So lots of ways to get started. But the best thing is to go to mobleymd.com, go to our chin implant page. And if you are from further away, we cater to people from out of town all the time. We'll make sure that the experience is seamless. Our office is about 15 minutes from Salt Lake City Airport. We'll take excellent care of you.